everyone, I'm Catherine Ruiz, a student nurse of Adventist University of the Philippines Level 1. Today I'm going to perform to you a return demonstration of performing a cleansing enema catheterization in my patient. So basically the equipment that I will be using is our enema catheter kit or enema kit tray, which includes our sterile gloves, a disposable tissue, lubricating jelly in a sachet, a catheter, enema catheter, our solution container, fleet enema, our bed pad, our blanket, and also our commode. So if you can see, all the equipments in here are just an alternative. Most of the equipments that I am using right now are just an alternative and not used in the actual procedure. This is just for the presentation purpose only. Okay, so after gathering all our equipments, I will now run the solution in my container. Okay, again, this is not the actual equipment that is used in the actual procedure. Okay, so assume that I already ran the solution. I will now do the priming and remove the air from the tubing. Make sure to not hold the tip of the tubing to remain the sterility. Okay, open the clamp to remove the bubbles. Okay, so the bubbles can cause irritant for the patient. That's why it is needed to be removed. Okay, once done, okay, we will now lubricate our catheter using this lubrication jelly in a sachet rather. Okay, open the sachet. For about 5 cm or 2 inches, lubricate the end of the catheter. Okay, so in this procedure, I will be performing 2 procedures. Enema catheterization using this solution container, and also this fleet enema. Okay, just like what we did in the first procedure, I will also lubricate the fleet enema. Remove the cover. Okay, some of the fleet enema are already lubricated on the tip, but this time I will be lubricating also it. Okay, and then let it sit here. Okay, so once done, I'm now going to go to my patient and introduce myself. Knock, knock, knock. Hello, good morning, sir. I'm Catherine Ruiz, a student nurse who will be working with you today. But before anything else, I would like to ask a few questions. Can you please, sir, state your first name and your last name? How about your birth date? Thank you very much. Can I see your wrist, sir, just to check your name tag? Okay, so thank you very much, sir. Okay, as I was saying, I'm a student nurse who will be working with you today because I got an order from your physician to give you and provide you an enema catheterization. So in this procedure, I will be inserting a catheter inside your rectum and run some solution and provide you some solution which is necessary for your treatment. Okay, sir? Okay, so do you have any questions? Okay, so to provide you privacy, I already closed the curtain and the door. And also, I will be using this blanket to provide you more privacy. Okay, so make sure to wash your hands and then apply the gloves. Okay, so we're doing this to prevent infection transmission to our patient and even to us. Okay, sir, I'm going to place this blanket to you. It's an alternative so that your blanket that you're using now will not get dirty or contaminated. Okay, and also I need you to position to your left laterally, okay, so that I can have an access to your buttocks. Okay, let me help you. Okay, and as well as your right leg, sir, you need to flex it acutely. Okay. Okay, now that the patient is already in the proper position, place a bed pad under his or her bottom. Okay, sir, can you lift your buttock, sir? Okay. If so, I'll help you. Okay. So once done, um, expose the buttocks of the patient and then lift the upper buttocks and then locate the rectum. Locate the anus of the patient. Okay, sir, I'm now going to start the procedure, okay? Okay, lift the upper buttocks. Okay, here is his anus. Okay, get the catheter. Okay, for an adult, I'm going to insert the catheter for about 7 to 10 centimeter or 3 to 4 inches. Okay, so sir, I need you to take a deep breath so that you can relieve the pressure, okay? Inhale, exhale. I'm now inserting the catheter. Okay, you're doing great, sir. Okay. Okay, once the resistance is already felt, use your non-dominant hand to hold in place the catheter, and then start providing the solution. Okay, once all the solution are already instilled or the client cannot hold it any longer, you may now close the clamp and then gently remove the catheter. Make sure to have your toilet tissue while removing the catheter. Okay, sir, I'm now going to remove the catheter. Take a deep breath. Okay, you're doing great. Thank you so much, sir. And then another towel to clean the anus of the patient. For clean the excess lubricating jelly from the patient. Okay, so this time I'm going to use the flit enema. Okay, make sure that the air is already removed. Now gently insert the flit enema to the rectum of the patient, slowly, gently, and then rotate it so that it can easily insert. Okay, so sir, I need you to take a deep breath and exhale. Okay, inhale, exhale. Thank you. Okay, once the resistance is felt, you may now compress the bottle. Okay, same as the large volume container. If all the solution are instilled or the patient cannot hold it any longer, you may now remove the solution. Okay, sir. I'm now going to remove the fluid enema. Take a deep breath. Okay, inhale, exhale. Thank you. Then also remove the excess lubricating jelly from the anus of the patient. Okay, so sir, thank you very much. You did very well. Okay, so this time I'm going to reposition you on a comfortable position. Okay, so I need you, sir, to remain still, remain lying down, and retain the solution inside your rectum as long as possible for around 30 minutes, which is prescribed by the doctor. And then once you cannot hold it any longer, I will assist you in defecating. In defecation of the patient, you may allow him to use the toilet, but make sure not to flush the toilet so that you can assess the stool of the patient. But if you need a sample of his stool, you may use a commode and assist the patient while doing it. Okay, so while waiting, you may now remove the used supplies. Okay, make sure to discard them properly. And also your gloves. And then make sure to perform hand washing. Okay, so once done, it's time for the defecation of the patient. Okay, so this time I need to get some sample of his stool, so I will be using this commode. Okay, in using this commode, make sure to position the patient in a sitting position. Okay, sir, I need you to sit down. I'll be assisting you. Make sure that the bed pad is under his buttocks. Okay, can you lift gently, sir? I'll be placing this to you. You may sit here. Okay. And once done, remove the commode. Place it here. And then reposition the patient in a comfortable position. Make sure to provide a pericare. Then remove the bed pad. And then place his original blanket. Remove the bed blanket that you used. Okay. Once done, you may now assess the stool of the patient. Then do hand washing, and then start the documentation. Okay, so thank you very much, sir. Thank you so much for your cooperation. I'll be giving this result to your physician, and then once I get the result, I'll make sure to return to you. Okay? Okay. And that is how you perform an enema catheterization.